All right. Now, please feel free to ask any questions at any time during the presentation. You can either do that by typing a question in the chat box or just turning your microphones on. If you don't feel that you want to ask a question during the presentation, there'll be plenty of time to ask questions afterwards. All right, so let us begin. All right, so this presentation is actually one of the workshops we have for the Essentials of Critical Care course, which we've run in a number of countries now, including most recently Tonga, and also Fiji, and Samoa, and Timor-Leste. All right, so for some this will be a refresher, and for some this might be a little bit new. All right. Sorry, I'm still admitting people into the waiting room, which is why you might have a dark square on your computer. All right. Okay, so what we're going to have a look at for the next maybe 40 minutes is discuss the high flow oxygen devices you may have available in your area, explain how high flow works, and also we're going to look at how we set up and disinfect and apply the Airvo. What I might ask you to do is, can you mute yourselves if you have your microphone?
Recording in progress.
Okay. If you have your microphone on, can you mute yourselves, please? I'm getting quite a lot of feedback. Okay, so some of the indications for oxygen therapy. Well, there are a number of reasons why we give oxygen in the hospital. I'm going to run through these quickly. So chest pain is probably one of the most obvious situations where we give oxygen. Obviously, sudden cardiac arrest. And for people with, so you're going to hear type 1 and type 2 respiratory failure talked about quite a lot in this presentation. So for those of you who don't know, your type 1 respiratory failure is where you have a failure to oxygenate. So where you have low oxygen saturations. Type 2 respiratory failure is where you have high carbon dioxide levels, so failure to ventilate. Some of the patients we see in our hospitals with type 1 respiratory failure would be your patients with pneumonia, or your patients with a chest infection. They'll have low saturation levels, so a problem with oxygenation. Patients that you may see in your hospital that have type 2 respiratory failure are your patients who your COPD patients, your long-term COPD patients, and also sometimes your asthma patients. So you'll often see these patients with high carbon dioxide levels. So there's a lot of talk out there at the moment, and a lot of evidence and research being undertaken, asking the question, is too little oxygen bad for you? And the answer, of course, is yes. We need oxygen to live. So too little oxygen is bad for you, but also too much oxygen can also be bad for you. And again, this is where the research is happening into how much oxygen is too much. We don't know how much oxygen is bad for you yet, but we know that if we expose our patients to lots of oxygen for a long period of time, it can actually cause more lung damage. Right. So one of the questions we ask ourselves as health people is, well, how do we know what the right amount of oxygen is? And it's really hard to know how much oxygen is the right amount of oxygen, isn't it? Because we can't see what's happening inside the lungs. So what we tend to do is we titrate the oxygen so we get good saturation levels. And when I say good saturation levels, we don't need to aim for oxygen saturation levels of 100%. We can actually aim for oxygen saturation levels between about 92 to 95%. Right? And the good thing about this is if we aim for lower oxygen levels in the blood, this means we don't give our patients too much, and we don't give our patients too much oxygen, and B, we can save the amount of oxygen that we deliver for other people. All right, so this next video is a video that you are going, I think all are going to be very familiar with. It's a video of someone in moderate respiratory distress. So I want you to have a look at this video and then maybe type in the chat box why are you worried about this patient? What signs of respiratory distress can you see with this patient?
I can't breathe. Please help me.
So what are some of the signs of respiratory distress you could see in that video? Is anyone willing to put something in the chat box? Yeah, Veronica has said labored breathing. Absolutely. It's quite difficult in that video, isn't it? Because she has a mask on, but you can still tell absolutely the ICU in in Vanuatu have said increased work of breathing. Absolutely. You can see her shoulders and her chest are moving quite a lot. So that's a really bad sign. What I'm going to show you next is the same patient a few hours later in severe respiratory distress. Okay. Are you worried about this patient? Yes. Why are you worried? What are you worried about? The ICU in Vanuatu are very worried, which is good. Lucia, risk of respiratory arrest. Absolutely, Lucia. If we don't treat her very soon, she could end up having a respiratory arrest. I agree. Anything else you're worried about? What other signs of severe respiratory distress can you see with that patient? Lucia, again, use of accessory muscles, yes. And I think in this video, she is using more accessory muscles than she was in the first video. Fatigue, yes. The ICU in Port Vila have said fatigue, so true. If you can imagine breathing like she is for hours and hours, you are going to get tired. So fatigue is a very, very late sign and a very worrying sign. Thank you, ICU. Anything else that you're worried about? I think one of the other signs of respiratory distress is that she was becoming quite agitated and anxious. All right, and this is one of the bad signs of not enough oxygen getting to her brain. So, if this patient came to your hospital, to your emergency department, or they were on the ward, what would you do? What would you do if this patient came to your hospital or to your ward? So someone has said commence on high flow oxygen. Excellent. That's a really good idea. Would anyone else start them on high flow oxygen? We've got some really good answers here. Lucia has said, check their vital signs. 100%, Lucia. Yes, check their vital signs. It's really important that we get some, we get the heart rate and their blood pressure and their respiratory rate as well. So absolutely check their vital signs. AD has said also vital signs monitoring and bloods. Really good, excellent. So we've got some, so we want to start high flow. We want to do a full set of vital signs, and we probably want to take some bloods as well. Though I think those are all really good suggestions. And obviously in real life, we'd be doing all of those things at the same time. Veronica has said, reassure, position, give oxygen using a rebreather mask. Now, Veronica, I like your answer because positioning is really important. You certainly want them to be sitting up so that they can get the most oxygen to their lungs. And I think reassurance, 100%. We need to reassure the patient that they are in safe hands and that we will look after them. I also like that you've said use a rebreather mask. So we've got got a couple of suggestions here. We've got that we can apply a non-rebreather mask, and we've also got that we could apply high flow. Both of those answers are correct. But my next question to you is, how long does it take to set up high flow in your department? Excellent. So AD has said that in their hospital, if the high flow machine has been disinfected, then it can start within 2 to 3 minutes. Fantastic. That's really good. And in Port Vila, less than 3 minutes. Excellent. So if you have a high flow machine that's set up ready to go with all of the tubings, it can be really quick to set up. But sometimes, if you have a high flow machine that maybe you haven't used for maybe 6 months, and maybe you can't quite remember how to use it, or maybe you haven't got all of the tubings, then what Veronica suggested about putting the patient on a non-rebreather mask whilst you get some help to set up the high flow is a really good idea. So not everywhere will have a machine, a high flow machine ready to go, all right? So a non-rebreather mask can really help like buy you and your patient time whilst you are setting up the high flow. Excellent. Okay. So I think we all, because this presentation is about high flow, I think we probably all agree that this patient will eventually end up on high flow, which is great. But also we kind of need to know how high flow works. Now, this has taken me quite a while to understand, all right? So the way I teach this now is, if you think about yourselves sat down listening to this presentation. All right. I hope you are fit and well people, and you don't have any problems with your breathing. So your respiratory rate is probably between maybe 12 to 16 breaths a minute. And you're probably breathing in about 20 to 30 litres per minute of air. Right? So in this slide here, you can see a police officer with like a speed gun. All right. So if you put a speed gun by your mouth and you measured how much air you were taking in to your lungs, it would be about 20 to 30 litres per minute. All right, so try and remember that number. So 20 to 30 is normal inspiratory flow. We fit and healthy people, like all of us, have an inspiratory flow of 20 to 30 litres per minute of air. Okay. Oh, Francis has just asked a question. Hi all, just checking, what's your O2 source? Francis, that is an excellent question. And we are going to, I'm going to chat about that a little bit later. All right, so thank you. Brilliant question. All right, so again, remembering our inspiratory flow demand is 20 to 30 litres per minute. All right. Now, let's go back a slide. So now imagine that you have climbed 50 stairs and you've got to the top. How are you feeling? How do you feel when you climb lots of stairs? Or when you have run 5 kilometers? Veronica, exhausted, absolutely. And someone else has said out of breath. Yes, Primrose, out of breath. Good. All right. So yes, when when we have done any exercise and we feel out of breath and exhausted, our work of breathing increases, doesn't it? And our respiratory rate increases. And what has happened is also our inspiratory flow has increased. So when we've climbed that flight of stairs, or we've been for a run, our inspiratory flow may increase to maybe 60 to 100 litres per minute. So it's doubled. However, because we are fit and healthy, our inspiratory flow, once we sit down and rest, will decrease again. Okay, but someone who is sick, who has pneumonia or a chest infection or COPD, their inspiratory flow demand will continue to be high. It will continue to be 60 or 100 or sometimes even 200 litres per minute. And if they continue to have that inspiratory flow demand, they are going to get tired and exhausted. So that's when we think about applying high flow so that we can meet that inspiratory flow. All right. And I think this is hopefully going to answer Francis's question about checking what your oxygen source is. So when you so let's go back to what Veronica said earlier about applying a non-rebreather mask whilst you're setting up your high flow. Okay, so this patient here, we want to apply the high flow, but we need to set up the machine. So whilst we are setting up the machine, we just applied a normal oxygen mask. Now that normal oxygen mask is plugged into a flow meter, and we're going to pretend that that flow meter is delivering 10 litres of oxygen every minute. All right. So this patient is breathing quite hard, and their flow demand is 30 litres a minute. So we need to match that flow demand. All right. So with they're getting 10 litres from the oxygen mask, they need to get another 20 litres from the room air. All right. So let's see what happens with this patient. Let's see how much oxygen they end up getting. So as you can see, the pink or the red, the oxygen, is filling the lungs a little bit, but not really very much. So this patient will still probably have low saturation levels. Okay. However, in the next slide, you're going to see the same patient, but this time we've applied high flow. Okay. Now with this high flow, the oxygen source is still from a flow meter, a 15-litre flow meter. All right. But the good thing about the high flow machine is that inside there's like a turbine, and that turbine pulls in room air. All right. Which means that we can deliver higher flow rates through the high flow machine, which essentially means that if this patient is requiring 30 litres of flow, we can give that 30 litres through the high flow machine. Okay, so this patient is getting 30 litres and he needs 30 litres. So let's see how much oxygen is getting into this patient's lungs. Huge difference. So you see, this patient will have better oxygenation levels than he would have on the normal oxygen mask. Okay. All right. Any questions so far? All right. So we've had a talk about how high flow works. Next, we've just got a quick video that was filmed in BG in Suva about how we set up the Evo.
Bula Vinaka. So now we are going to set up the Evo. In front of you, we've already disinfected the machine, which we have completed the 55-minute cycle. And with the red disinfectant tube still connected, now we're going to set up the Evo 2 machine. So we're opening up all our tubings. So we have the new consumable set, the adapter, the heater breathing circuit, and our water chamber. So we're removing the blue pot caps from the water chamber by twisting and pulling the tap upwards and upwards. Then we're removing the bracket holding the sterile water supply tube from the water chamber. So we're removing and discarding the red disinfectant tube. So now we're going to align the pots on the water chamber with the pots on the adapter. And then pressing down firmly to connect both pieces together. Align the two pots on the chamber with the two pots on the machine. So we're pushing the water chamber into the machine, and it should make a click when it's firmly in place. So once that is done, we'll attach the water supply tube spike into the bag of our sterile water. Cap on the side of the bag spike. And then we'll ensure that the bag sterile water is 20 centimeters above the humidifier. And we together also, while checking on this, we'll be checking to see if water is automatically filling into the chamber. If it rises above the water level line, then we'll need to replace the chamber with a new one. So once all that is done, now we're going to connect the heater breathing tube by sliding the blue circuit connector onto the machine. And we'll push down to lock, then the Evo 2 is now set up.
So reasonably okay to set up. And I think obviously, like a couple of you said earlier, many of you already have the Evo set up ready to go if you need to use it on a patient. And I think that's what a lot of places do. They already have it set up so that it can just be wheeled to the patient and connected. So the next video is, so we know how, we kind of know how the Evo works. We know how to set it up, but this video is about how to use the Evo and how to, there are only maybe, there are only a few buttons, but it's just knowing which buttons to press and which buttons to press together to unlock the Evo so that you can adjust some of the parameters.
Step 1. Switch on the Evo 2 by pressing on/off button, first arrow for 5 seconds. If a green light appears, second arrow, then it is safe to use. If an orange light appears, do not use the Evo 2. Step 2. Set up the machine as per patient's prescription. Press and release mode button, arrow, to cycle between the 3 settings. Dew point temp, degrees Celsius, gas flow rate, liters per minute, oxygen saturation, percentage O2. Changing temperature, both up and down buttons together for 3 seconds. As shown to unlock settings. The padlock SIM-lock symbol will now disappear. Use up or down arrows to adjust temperature. Recommended temperature is 37 degrees Celsius. Press and release mode button to lock screen. Flow rate. Press and hold both up and down buttons together for 3 seconds as shown to unlock settings. The padlock symbol will now disappear. Use up or down button to adjust flow gas rate. Recommended rate 45 liters per minute. Press and release mode button to lock screen. Change to saturation. Turn the flow meter on the wall or cylinder to adjust oxygen saturation. Use flow meter to reach desired saturation. Recommended O2 percentage is 50%. Step 5, while waiting for the machine to warm up, place the patient interface on. Ensure that the interface is free from touching the patient's ears. Step 6, wait for the ready-to-use symbol, arrow, to appear on the screen. Now connect the patient interface to the heated breathing tube. Push both tubes together until you hear a click. The patient will feel warm air coming through the interface. This is normal. Step 7, if using elbow and neck child, press and hold the mode button for 5 seconds to activate the junior mode sign. Yeah. To deactivate, press and hold the mode button for 5 seconds. Step 8, when using an EVO tool, always monitor the patient's oxygenation saturation, SpO2.
So, so that was a really quick video about how to set up the EVO. I think probably the most important thing to remember about that is that you control the flow rate by pressing the 2 arrow buttons to unlock, and then you can increase or decrease your flow rate on the EVO. If you want to increase or decrease the amount of oxygen you deliver, you have to do that via the oxygen flow meter. All right. And when you do adjust the oxygen via the oxygen flow meter, it's really sensitive. So you have to do that really quite slowly. All right. And then I think, the next video is just explaining the relationship between flow and oxygen. So if you think about the EVO and imagine you've dialed up 3 liters of oxygen through your flow meter, and that's going through your tubings, but you've dialed up 30 liters of flow. All right, so what that means is you've got 3 liters of oxygen going through and 27 liters of air going through the EVO. All right. If you then keep the amount of oxygen going through the tube as 3 liters, but you increase your flow to 50, that means you still have 3 liters of oxygen going through, but you now have 47 liters of air going through to make up that 50 liters. What that means is that the air because there's more air going through, it's diluting the amount of oxygen in that tubing. So on your AVO, you will see that the amount of oxygen you are delivering has actually decreased because you have increased the flow. All right. So hopefully this video will assist you in understanding that concept a bit further. Oh. Oh my God.
How to
Hopefully that is a little bit clearer. Does anyone have any questions about the relationship between oxygen and flow? No. All right. If you think of any, we can maybe answer them later. All right. So this is the final video, and this is about how to disinfect the Evo after your patient has finished using it. Okay.
Clean and disinfect the Evo 2. Switch off the machine, unplug from the main. Then we remove the heated breathing tube. Discard. Remove the water chamber and sterile water bag from the machine. Once you remove all the circuits, clean outlet elbow on the right. Dip sponge stick onto the mixture of warm water with approved mild detergent solution. Thoroughly clean the outlet elbow from both ends using a sponge stick. Rotate sponge stick while cleaning. You can always discard. Now clean the outlet elbow with a disposable cleaning lint-free cloth. Clean both ends. Continually rotate your finger while cleaning and go as far as inside as possible. You can always wipe outside the Evo 2 using a disposable alcohol wipe, which you can later discard. Once all your cleanings are done, now we are going to disinfect the Evo machine. Using the red disinfection, which is red in color, so we'll disinfect the machine immediately after cleaning. So we insert blue end of the tube onto the top pot, push down to lock. Insert blue filter cap onto the right pot. Once you've connected the red disinfectant tube, you may now turn on the machine, pressing and holding the mode button for 3 seconds. Again, if the air filter needs changing, the machine will promptly advise. If there are other prompts, notify the biomed while disinfection, while the machine is being disinfected. Once we've connected the disinfectant tube, the machine will now automatically start the disinfecting cycle, which takes about 55 minutes. Again, if any problem occurs and the machine stops disinfecting, you can always restart the cycle. And if the machine keeps stopping repeatedly, you can always notify the biomed technician. So once the disinfection is successfully completed, it will show the disinfectant cycle.
Perfect. So I think the main thing to remember with regard to cleaning and disinfection is do not throw out the red hose. The red hose can be used many times. If you throw that hose out, you will not be able to clean the Evo safely and effectively. And the other thing to note is we often just use like a cloth and put our finger inside the hole at the top and our finger inside the hole where the humidifier is and clean that way. You don't need the sponge on the stick to do that. All right. Now, if this is helpful to you, there is an app on that you can get from the App Store. Once you have downloaded it, it doesn't take up any data and it doesn't cost any money. But what it does do is that you can, part of the program is you have like a simulated AVO that you can practice pressing the buttons and adjusting the oxygen and adjusting the flow, so that if you maybe haven't used the AVO for a few months and you have forgotten how to use it, this app is really great at helping you remember. I have it on my phone and I use it quite a lot. I actually use it a lot for teaching. It's a really good teaching aid. So for those of you who would like to share this information with your colleagues, this is a really great app to have. All right, now during that video, we had a couple of really good questions. So Villa ICU asked, is there any target of oxygen on the AVO? Do you mean what is the highest amount of oxygen you can deliver via the AVO? Is that what you mean? Yes, right. So, right, good question. So the highest, so the answer I'm going to give you is not, it's a bit fluffy. So if you're running the AVO of your 15-litre flow meter, the most amount of oxygen you are going to be able to give will depend on the amount of flow you're delivering. So remember going back to that video with the funky music. If you have a flow of 60 litres, all right, and you have put your oxygen meter up to, and you've put your oxygen flow meter up to 15, all right, that's obviously the most amount of oxygen you can give. That might end up being about 40 to 45% FiO2 oxygen, all right. However, if you have a flow of 30 litres and you have your oxygen flow litre at 15 litres, the amount of oxygen you're delivering will increase, maybe to about 60 or 65. So I think what may help answer this question better is with your ICU there, maybe get someone to download this AVO app and try practicing adjusting your flow and your oxygen to see how much you can actually deliver. Does that make sense? I hope it's quite difficult to explain on a PowerPoint. I think you either have a go with the app or maybe get your machine and have a play with the machine as well. Francisco from Dili, hello. So he's asked, our colleagues from ICU are asking, is it possible to share the contents and video with us? Absolutely, yes, it is, Francisco. I'm recording this session, so we'll put it on the Facebook page, or I can also send you the recording and the link. Excellent. Oh, another message. No problem. Any other questions? We'll keep going.
Hi, yeah, I've got a question.
Yes.
Yes, so I'm Francis. I work in the Solomon Islands.
Hi,
I'm curious as to what their oxygen sources are. I'm just concerned we haven't introduced high flow yet because we only have cylinders. And I just wondered how quickly people were experiencing that they were emptying their cylinders.
Very good question, Francis. So, is anyone out there who has used high flow a bit that's able to answer Francis's question? If not, I can certainly have a go. No. All right. So Francis, when you're running the Evo, you'll be running it off a 15-litre flow meter.
Mm-hmm.
Yeah. And then so the amount of oxygen you're delivering is always going to be whatever you're delivering through that flow meter. So
Okay.
so it's just like, so if you had a non-rebreather and you were delivering at 10 litres, that's the flow that you would be taking from the oxygen cylinder. So it's actually not that much. I think what people get scared of is because you're then delivering flows or a combined flow of 50 to 60, that extra flow is actually coming from the air in the environment and is pulled into the Evo through a turbine. So it's not pulling oxygen from the cylinder. Does that make sense?
That's reassuring. Yep, that makes perfect sense.
Right.
Have you ever run them on oxygen concentrators?
Yes, yes, absolutely. They can be run on oxygen concentrators, and I think in NurseTOK during COVID, they rigged up maybe 2 or 3 oxygen concentrators, so had a combined flow of 15 litres of oxygen, and ran those 3 cylinder concentrators together into the Evo, which was amazing, and it worked.
So just a question: if you only need 15, well, if your maximum is 15 litres of oxygen, why did they need 2 concentrators?
The patient that they had the 3 concentrators on was extremely sick, and they didn't have enough, unfortunately, oxygen. So there was it was one of those very resourceful things that happened during COVID, and the patient survived. Really.
Well, that's the best outcome. All right. Well, thanks for that. You've sort of reassured me a bit. We've got a couple of Evos, and we've got quite a few circuits, but I've always been a bit worried. But
100%. I know where you're coming from. I'm happy to chat further if you want any further assistance, support, reassurance. Not a problem. And that goes for anyone. All right.
Sorry.
Oh, no, you're right. So we've got another question. Dulcie, we have not introduced high flow here in Alatau. We also experience so much power interruptions. So a colleague is asking if the Evo 2 has an inbuilt rechargeable battery, or does it operate on direct power? Excellent question, Dulcie. The short answer is no, it does not have an internal battery. So if you have a power cut, the Evo will turn off and you will no longer be delivering oxygen. We had first-hand experience of this in Lautoka. There was a power cut and there was a couple of patients on the Evo. Thankfully, we had non-rebreather masks at the bedside. So we literally had to quickly swap the patient onto the non-rebreather until the power came back on. Yeah. So that's probably one of the Evos are a great machine, but I think that is one of the downsides of the Evo, is that it does not have an inbuilt battery. What else? Any other questions? If not, we'll continue on to the next slide. So hopefully this session has allowed us to think about and discuss the oxygen devices you have in your areas. We went some way to explaining how high flow works and how we set up, disinfect and apply the Evo. So thank you very much for your time. I'm just going to get rid of this. Thank you, Francis. Yeah, no problem. Thanks for your excellent questions. What I might ask, if whilst you're thinking of other questions, if you have any, for those of you who didn't manage to register earlier on, can I please ask you to scan the QR code on the screen and just register your details for us, please? And as I said, if anyone has any further questions, please feel free to get in contact with me. It's not a problem at all. There's a lot of, there are some places in the Pacific who use the Evo all of the time. Samoa is a really good example. They use high flow probably most weeks. And there are maybe people in the Pacific who don't, like the Solomon Islands, who haven't introduced it yet. So there's varying degrees of confidence and exposure. So very, very happy to support further if required or if needed. All right. No problem, Jovino. Thank you very much for joining. And hopefully we'll see you all next month. I'll be in touch with what our next topic will be. If you also have any thoughts about what you would like to see presented, then please also let me know, either via the WhatsApp group or the Facebook page. All right. Thank you. Thank you, Veronica. We'll see you soon. I'm just going to stop recording.